Examination of gallbladder. Introduction. The gallbladder is a pear-shaped structure, 7.5 to 12 centimeters long, with a normal capacity of about 25 to 30 milliliter. The anatomical division of gallbladder includes a fundus, a body, and a neck that terminates in a narrow infundibulum. Surface marking of gallbladder. It lies on the undersurface of the liver, in the main liver caesura, at the junction of right and left lobes of liver. The gallbladder is situated at the junction of 9th costal cartilage and outer border of right rectus abdominis muscle. Gray-Turner's method. Draw a line from the left anterior superior iliac spine through the umbilicus. At the junction of this and the costal margin is the gallbladder, provided the shape of abdomen is normal. Palpation of the gallbladder. The normal gallbladder cannot be felt. The gallbladder is occasionally palpable below the right costal margin in the midclavicular line. If enlarged, it will be felt as a soft, rounded mass, which moves down on inspiration. Examine for the borders or edges, surface, consistency of gallbladder, tenderness, guarding, rigidity, and movement with respiration. Rolling the patient 45 degrees to the left makes the gallbladder more visible and facilitates its palpation. If palpable, it suggests enlargement or distension, secondary to biliary flow obstruction, and/or infection. For example, gallstones, gallbladder, or pancreatic malignancy, cholecystitis, etc. When distended, it may be palpated as a firm, smooth, or globular swelling, with distinct borders, just lateral to the edge of the rectus abdominis, near the tip of the 9th costal cartilage. Its upper border merges with the lower border of the right lobe of the liver or disappears beneath the costal margin and therefore can never be felt. The ease of definition of the rounded borders of the gallbladder, its comparative mobility on respiration, the fact that it is not normally bimanually palpable, and that it seems to lie just beneath the abdominal wall, helps to identify such a swelling as gallbladder rather than a palpable right kidney. The gallbladder can usually be palpated in the following clinical situations: carcinoma of the head of the pancreas or other malignant causes of obstruction of the common bile duct, mucocele, or impacted gallstone in the neck of a collapsed, empty, uninfected gallbladder. Mucus continues to be secreted into its lumen, and in later stages, the gallbladder becomes palpable. In this case, the bile ducts are normal and the patient is not jaundiced. In carcinoma of the gallbladder may be felt as a stony, hard, irregular swelling. Murphy's sign. In acute cholecystitis, inflammation of the gallbladder, with resultant peritoneal irritation, leads to a well-localized pain in the right upper quadrant, usually with rebound tenderness and guarding. Often, an exquisitely tender, but indefinite mass can be palpated. Ask the patient to breathe in deeply and palpate for the gallbladder in the normal way. At the height of inspiration, the breathing stops, with a gasp as the mass is felt. This represents Murphy's sign. It is useful for differentiating pain in the right upper quadrant. Typically, it is positive in acute cholecystitis, but negative in cholelithiasis, chronic cholecystitis, uncomplicated cases of gallstones, ascending cholangitis, and pyelonephritis. Courvoisier's law, also known as Courvoisier's sign or Courvoisier-Terrier's sign or Courvoisier syndrome. This states that, in the presence of jaundice, a palpable gallbladder is unlikely to be caused by gallstone obstructing the common bile duct, and may implicate possible malignancy of gallbladder or pancreas. This is because it is likely that the patient will have had gallbladder stones for some time, and these will have rendered the wall of the gallbladder relatively fibrotic and therefore non-distensible. However, the converse is not true because the gallbladder is not palpable in many patients who do turn out to have malignant bile duct obstruction. To get more such high-yield medical content, Don't forget to subscribe. BasidiaMED. The easiest and fastest way to take advanced clinical history.